Board. Okay, so the first question is just tell me a little bit about your professional role and what your primary responsibilities are.
Okay, so my name is Fiddler. I'm basically the director of urology. My title is service line administrator, but I basically direct the operations of the department. I work with the pediatric department of urology and the adult part. Basically, I help make sure that things are running functionally in all of our 7 clinics. And we deal with everything concerning sexual health of our patients to bladders and kidneys.
Fun.
Yep.
So what type of education and training did you receive to prepare for this role?
So for my specific role, I obviously went to college for health administration, and so I'm definitely working in the role that I'm in. But, you know, specific to some of the populations that we work with, you know, our transgender population and our pediatric population, we had to go through what's called sensitivity training to make sure that we're able to, you know, basically assist these patients that are falling into these populations that sometimes have a difficult time.
Okay. And what does a typical day look like for you?
A typical day for me is definitely coming into the office. Today I'm at IU North. Sometimes I'm at Riley. Sometimes I'm at University. Depends on who's needing to be checked in on. But I'm very much part of making sure that the providers are credentialed, that they're properly getting their billing done, and then just overseeing the people that I manage.
Okay, so what is the most rewarding thing in your job and what is the most challenging?
I would say the most rewarding is definitely just the people that I work with. You know, we have upwards to almost 35 providers. That's nurse practitioners and surgeons. We have close to 70 staff, 70 team members. And so just getting to know them on a professional and a personal level and seeing the amazing work that they do in the office every day for the variety of patients that we have. I would say the hardest thing is just being stretched where I can't be everywhere at the same time. And so there's a lot of places I need to be, but I just make sure I'm where I'm most needed for, you know, a particular day. So if I could clone myself, that would be great, but I can't.
So how can someone who is interested in sexual health benefit from being in this role?
So someone who is interested in sexual health, you know, we have, it's interesting. I work with different providers that deal with sexual health. So we have a surgeon here, Dr. Burney, who, yeah, that's okay, that deals specifically with men's sexual health as far as, you know, their fertility after having cancer or just having things like erectile dysfunction. And so you have that aspect of sexual health. And then we have another doctor who he specifically works with the transgender population, helping them to, you know, conform to the lifestyle that they want to live. Also doing surgery that is helping them to fulfill that life. And so, you know, someone who wants to be involved with those populations, I mean, it can be on a doctor level, but can also be in a professional level where you're able to assist those providers to make sure that those populations are being promoted.
Amazing. So overall, how much of your job is related to sexual health? Because I know you do all different types of things in urology.
Yeah, yeah. I would say, you know, gosh, half of it. Half of it is probably dealing with that. You know, we have providers that are dealing with, you know, the sexual health for a lot of patients, not just transgender and men's sexual health, but there's things that come up all the time. And so I would say when you're looking at the overall population of our patients, that's being touched on at least half of the time.
Wow. Who would have thought?
Yep.
So how does having a knowledge in sexual health help you in your job overall, since you do have to deal with sensitive populations, like you said, as transgender?
You know, you have to embrace. You can't just, you know, we all have our core beliefs, right? But you have to accept and you have to see beyond what's in front of you and realize that there are people that are dealing with really hard things, and embrace what they're going through so that you can help them in making sure that they're living a life that's fulfilling for them.
So what is the most common type of appointment do you get for like sexual health things? What do you see most often?
Most often, I would say probably erectile dysfunction.
So you talked about sensitivity training. Can you describe what that is?
Yeah. So when we brought Dr. Roth on and he started doing these consultations and these surgeries for transgender patients, we had a nurse come over from Eskenazi who teaches sensitivity training to people all over the state. And what that entails is using correct acronyms when you're talking to anybody in this population, and being sensitive in the way you're speaking with them. And so I don't have it on right now, but on my, you know, a lot of our tags in our offices, you know, they'll have a pronoun tag, like I'm a girl. So my pronouns are she, her, and hers. But there might be a person who looks very much like a girl, but feels like a boy. And so they might have a pronoun tag that says his, him, and he. So it's just being sensitive to, you know, not always just looking at a person and assuming that they're a specific sex, but whatever they're identifying with, and being respectful of how they want to be treated.
Cool. So
Everybody in the world should take sensitivity training.
oh, I agree with you there.
Everybody should take sensitivity training. Yep.
So tell me about what happens when someone wants a gender reassignment surgery.
Wow. You know, I probably couldn't give you the whole specifics because I haven't, you know, Dr. Roth is very new to our department. He probably would be able to answer that question better. But I know that there is a lot of time talking with the patient, a lot of consulting, a lot of therapy to make sure that this is the right decision. And then going through and talking about what are the options for, you know, having a specific procedure done. When they're redoing, like, say you have a male that wants to go to a female, what you have to do, and you have to explain to them how they have to reroute, you know, the urethra and where that needs to go, and how the folds of the skin need to make the girls the parts of a girl. And so there's a lot of just making aware of, you know, the implications that this is going to be mentally and physically.
How long does this process take? Do you know? So if like someone comes in, they're like, I think I want surgery. How long would it take them till they could actually get that surgery if they choose to?
I think it's different for every person. And like I said, I think Dr. Roth would be the person to ask this, but I think on average, we're talking about a year, sometimes even a little bit longer.
What are the typical ages for just any patients that are coming for sexual health or transgender? You said you work with pediatric and adults.
Correct. And we will have some pediatric patients that are starting to already, you know, feel like they're fitting in a different gender than what they have been born with. So that does happen on a pediatric level, but not as much as with an adult. For the adults, I would say it's anywhere from 18 and up. I mean, there's a variety of ages. It's not just one core group of ages that this affects. It's over multi levels. multi-ages.
So what are 3 health related issues that you think should be prioritized like right now?
3, say that again?
3 sexual health related issues that should be prioritized.
I think definitely what I just said a minute ago, that everybody should take sensitivity training. I mean, everybody needs to be aware. 2, there needs to be more education on, just embracing and helping some of these things that people are feeling or that they're going through, that they're not alone. And then I would say that we should all just be educated. I don't know, I'm probably not answering the question, but I feel like there needs to be more of an awareness, more of an education, and more of an acceptance of just that there is a lot of stuff that people are going through within this world. And, as far as sexual health is concerned, you need to be embracing.
How do you think the best way that people can start to embrace? Do you think we should integrate education into our public schools? Should people be tasked to figure it out on their own?
That's a difficult question, because if you say, I'm going to teach this in elementary when we talk about the birds and the bees, or we're going to talk about this in health class in high school, you're going to have, of course, a divided group of parents who are going to say, no way, we're not doing this, and others who are going to be cheering for it. So I don't know that a school setting is the place to do it, but then if it's not in school and you have a group of people, where are you doing it? I think that workplaces need to be doing this, as young adults and adults enter into new places of work, or even at the college level, it's something that needs to be done so that people are having more of an awareness.
Why do you believe that there are still so many issues when it comes to like transgender awareness and sensitivity? As you know, lots of people they struggle with accepting other people's identities.
Mm-hmm.
Why do you think that like so many other people are just against it and struggle to accept it when it's not part of their own personal lives?
I honestly think it's a generational thing. Look at generations and how we lived in the 50s and the 60s and the 70s. And as we get older, people are becoming more liberal, right? I mean, this is just my own feeling. It's not how it is necessarily, but that's how I perceive it. As I look at my great-grandparents, my grandparents, and my own parents, I think things are changing for people who are feeling like they can expand outside of how things have been in the past. And not everybody is always willing to embrace as they've been brought up in a certain way. Does that make sense?
Yes.
So it could be just because of the background that they come from.
You're right. So do you have any last thoughts or advice for anyone that is considering hospital administration? That is definitely a field that is growing.
Yeah, I would say definitely, and hospital administration is a great degree to go into. Healthcare is never going away. There's always going to be healthcare. When it comes to sexual health, that is something that's always going to be needed for patients forever. I would say the best thing I could offer anybody if they're going into that field is to do that sensitivity training. It's going to keep spreading, and it's going to keep being added to. And so the more that people take that on, they're going to be learning more of how to work with those around them and work with those that they see as patients.
Well, perfect. Thank you so much for sitting down and taking the time to have an interview. This has been very helpful to me, and I will probably see you soon. Tell Erica that I love her and I miss her.
I will. Nice to see you, Sarah.
You too. Bye.
Bye-bye.